Hello friends, welcome to the part 2 of Acute Understanding. Now here what we are going to discuss is about difficulties and strategies in handling acute. जब acute patient अपने पास आता है तो क्या हमको याद रखना चाहिए और हमको क्या करना चाहिए, these things we are going to discuss over here. So let us first understand what are the difficulties in handling acutes. Now difficulties can be described under two aspects, that circumstantial difficulties and misconception about homeopathy. Now circumstances which make acute handling difficult. The first important difficulty is the time is too short. When the patient comes to you, he is expecting quick results. So when he has got fever, he expects that his fever will get over in 10 minutes, 15 minutes, 1 hour. So the time is too short and quick results are expected from you. अभी का भी डॉक्टर साहब इसका फीवर ठीक करो, 2 घंटे हो गए फीवर ठीक नहीं हो रहा है. सो दे विल पुट यू अंडर अ लॉट ऑफ प्रेशर. They are in distress and they require quick assistance. They require quick help. And then second thing, when you ask about symptoms, when you try to take their histories, they are not cooperative. They are already under distress. Pain ho raha hai, fever is there, child is cranky, and in that situation when you try to take history, they are not cooperative. They say no, just give remedy for fever. I'll discuss with you later. मैं आपको बाद में बताऊंगी सब चीज़ें. Original history is masked. Disease symptoms prevailed. You will talk कि आपको पानी की प्यास कितनी लगती है. They will say कि leave all that thing. मेरे को गला दुख रहा है, मेरे को उसका ज़्यादा तकलीफ हो रहा है, उसके लिए दवाई दे दो. And the last important thing is the change in generals and mentals, they mislead. क्या लेना है, क्या नहीं लेना है, कौन से सिम्टम्स लेने हैं, कौन से सिम्टम्स नहीं लेने हैं, is very crucial. Now there are also misconceptions about homeopathy and homeopaths themselves. Lot of homeopaths, they are not so confident in handling acutes and they feel that homeopathy is not working in acutes. They feel homeopathy is slow acting. Many patients, they feel that homeopathy is meant only for chronic diseases. And many times doctors themselves are not confident to handle acutes. So these are the common difficulties which you have when you try to face acutes. Abhi now handling acute cases, what are the questions arise? There are a lot of questions in the mind of a homeopath. If you ask 10 homeopaths, they will give you 10 different answers. And this is the biggest problem today also everybody is facing in the clinic. A very important question and a very important thing to understand. There are doctors who will say that should I prescribe specific? A patient with tonsillitis come, then should we give him Muxol for acutes? What are the symptoms to be taken? Should I prescribe on disease symptoms or should I prescribe on other symptoms? Or only acute symptoms to be taken? Or mentals to be taken or not? Physical to be taken or not? Emotions लेना है नहीं लेना है? Should I give mixture? Should I give repeated dosage? Should I prescribe on PQRS? So there are many questions arising in the minds of a homeopath. What is the totality to be taken and how to prescribe in acutes? But if you understand what are acutes, the first slide, if you understand what are acutes and if you follow it properly, then this question will not arise and you will be able to manage acutes properly. So what is the strategy when handling acutes? Now as the definition goes, the acutes are different. What are acutes? They are acute exacerbation of a latent sura, and then there are other situations which are seemingly like an acute but not an acute. Now the first situation out of this is called as indisposition. So what is indisposition? Suppose there is a patient who comes to you and he complains that 2 days back he had been to a party. He ate lot of food, lot of junk food in the party. He overate himself, and then yesterday he was suffering from diarrhea. He went to stool 4 to 5 times a day. Today he comes to you in the clinic that he still has got some diarrhea. He is better than yesterday, but abhi bhi diarrhea continue hai. What to do in such situations? Now mind you, these are indisposition. The diarrhea is happening because the body is trying to throw out the excessive food or the excessive toxins which you have had in yesterday. जब आपने ओवर ईट किया है और जब अभी आपकी बॉडी उसको टॉलरेट नहीं कर रही है, तो बॉडी इज ट्राइंग टू थ्रो दोज टॉक्सिन्स आउट. So these are the cases for indisposition. In these cases, no medicine is to be given. Just prescribe placebo. Then there is second situation which is called as an acute exacerbation of a chronic disease. उसका मीनिंग क्या है? Like a patient of asthma comes to you. Acute में आया है तुम्हारे पास, उसको breathlessness हो रहा है. Now this is not an acute case. It is an acute exacerbation of a chronic disease. He is already suffering from asthma, and then this is an acute exacerbation. In this, if you try to prescribe any acute remedy, this will not help. This situation calls for constitutional prescription. Repeat the dose if required, and the patient will be better. And then there are situations which are called as acutes and epidemics. In these cases, like patient with fever, there you follow the chart of acute. So coming again to indisposition, strategy for indisposition like acidity, malaise, coryza, gastric upset due to overeating or heavy foods, mild injuries, abrasion, etc. These are all indisposition. These are self-limiting and they do not require treatment. Understand one thing, they do not require treatment. Don't prescribe in these cases. Acute exacerbation of a chronic disease, asthma, pulmonary coughs, ulcerative colitis, etc. This arises from mesoderm. So their only constitutional remedy is to be prescribed, repeated. Now what is the golden rule? One of the most important slide and one of the most important aspect to understand acute. The golden rule. He who prescribes the least is the best homeopath. Mind you friends, prescription is not important. आपको पता होना चाहिए कि कब प्रिस्क्राइब करना है और कब प्रिस्क्राइब नहीं करना है. When you don't prescribe, when you know when to prescribe and when not to prescribe, you are the best homeopath. A good knowledgeable homeopath will not prescribe every time. He will handle the patient nicely and give him placebo. He is the best homeopath, mind you. Any patient who comes to your clinic need not necessarily that you prescribe remedy to him. Understand what is the situation, क्या ज़रूरत है, what he was having, what he was suffering from, where he is traveling from, and the one who prescribed the least is the best homeopath. Be a minimum prescriber. Every acute illness initiates a reaction in the body called as a immune reaction, and there is an internal doctor which helps to heal himself. Now only when this internal doctor fails, mind you, only when it fails, a physician is justified in prescribing, helping the body to recover. आपके दवाई में क्या है? There is nothing. It's just stimulating the vital force to recover. I'll give you an example. Patient comes and says कि doctor, yesterday I was having loose motions. I was having 40 loose motions. I was so weak that I was not able to come to your clinic. Today I am feeling little better and that is why I have come to your clinic. Give me some remedy. What will you do in this situation? nahi, you cannot prescribe. The patient is already on the path of recovery. Yesterday he was suffering from 40 loose motions, today he is suffering from 20 loose motions. The body is already healing. In this situation, you should not and cannot interfere. Let the body heal itself. If you interfere in this situation, you are going to spoil your whole case. Then there are other situations when we should not prescribe. If the patient comes after the storm is over and the acuteness has reduced, if generals are better, patient lost appetite has returned, patient's lost stamina is returned, his lost desire to work is returned, अभी वो काम पे जा रहा है, उसमें ताकत आ गई है, he is feeling better, don't prescribe. If you find patient's symptoms are little bit worse during full moon or new moon, 2.5 days before new moon and 2.5 days before full moon, before and after new moon and full moon, don't prescribe. When the patient has been exposed to temporary aggravation, like again indisposition kind of a situation, headaches after perfumes, mild pains after injury, don't prescribe. Another very important thing is the return of original symptoms. Patient says that this is the symptom he was suffering from 10 years back. पहले मुझे ये तकलीफ होती थी, काफ़ी सालों से ये तकलीफ नहीं थी, अभी आपकी दवाई शुरू करने के बाद वो सिम्टम्स वापस आ रहा है. Return of original symptom, ROS, don't prescribe. When you see Herring's law of cure is being followed, when you see Herring's law of cure coming into picture, don't prescribe. Say example, patient is suffering from asthma and after your treatment the asthma is better and now he comes with a new complaint of skin complaints. Don't prescribe, should not prescribe. Now after this situation when we know that when to prescribe and when not to prescribe, what are the things you should observe after prescription? Suppose you have prescribed for a remedy, उसके बाद next क्या करना है? What are the things you should observe? If there is initial aggravation, then it's a good sign. If the patient's lost desire in surrounding comes back, the patient was feeling so weak that he was not participating, but now his interest in surrounding is come back. वो न्यूज़पेपर के लिए मांग रहा है, वो टीवी देख रहा है, वो खाना मांग रहा है, उसको काम पे जाने की इच्छा है, नींद अच्छी आ रही है. These are all the situations where you should not prescribe. You should lay your hands off and observe. Whenever you see a little bit indication, consider that your medicine is 100% right and the patient will recover. Herring's law means when not to prescribe. Suppose a patient of ischemia comes to you and now then he complains of arthritis, good sign, don't prescribe. From arthritis the patient complains of another illness, like when he goes after arthritis, if there is a hypertension, change the remedy. From spondylitis to diarrhea, don't prescribe. Asthma to cough and cold to eruptions, don't prescribe. So this is in general about understanding acutes part 2. You can read all these things in more details in Dr. Vijayakar's book Theory of Acutes part 2, and be thorough with the complete theory how to prescribe. Now friends, in the next video will be sharing us few cases. I'll be giving you few cases. You need to solve those cases and then we can discuss about how to manage acute cases. Thank you.